My pleasure to welcome all of you to the second event in our educational seminar series, which was launched really in part through generous funding through the National Child Traumatic Stress Network, where we're doing some increased community outreach. My name is Dr. Sarah Tannenbaum. I'm the Senior Director of Outpatient Clinical Services here at the Baker Center, and it is my great pleasure to introduce Sarah Gurney today. She's one of our senior social workers who is a fantastic clinician, and I have to really say that Sarah, it's thank the Lord that there are people like Sarah out there willing to see some of the most challenging, complex kids and families, that we work with in the mental health field. She's been a clinical social worker working with children, adolescents, families for over 15 years in a number of settings, many of them really intensive settings like therapeutic summer camps, respite services, in-home therapy, residential treatment centers, community-based treatment centers, and now we are lucky enough to have her on staff with us at our outpatient center, the Center for Effective Therapy here at the Baker Center. She primarily focuses on providing evidence-based treatments for children, teens, and their families, and really, I think, specializes in the trauma and depressive areas, primarily, although she's a skilled clinician across the board. So again, just a couple housekeeping things before I turn it over to Sarah. We're thrilled to have you. Please keep yourselves on mute. Any questions that you have, please put them in the chat. I'll take them, and then Sarah will respond to them at the end of the talk. So we'll save those towards the end. And Sarah, turning it over to you.
Hi, welcome everybody. I'm excited to be here with everyone this morning. Very excited to talk to you about depression in kids and adolescents and how it differs from what we might stereotypically expect from depression, how it may be different than what we might expect from an adult. And when we identify that a kid is depressed, what do we do about it? Because that's step one, is identifying it, but then if you've only identified it, but you don't have any strategies on how to support them, that's obviously got to be the next piece of the puzzle. So as Sarah said, I'm a clinical social worker at the Center for Effective Therapy in Waltham. I work closely with both of our locations in Waltham and Boston. I've been with our center for about the last 2 years, and I've been in a variety of settings before that. And really specialize in working with kids and teens and their families around areas of depression, anxiety, traumatic stress, post-traumatic symptoms, as well as a number of other areas as well. But I would say those are my wheelhouse and like where my heart is in this work. As Sarah said, please hold your questions for the end. Want to make sure we're getting to everybody and holding space for that. And we will get started. So I want to talk first about the scope of our talk today. Depression is obviously a really big topic, and there's a lot that we could say about it. So my goal today is to provide a broad overview of what depression looks like in kids and adolescents, how to recognize it, some of the treatment options that have been proven to work, and how to support a child or adolescent who is struggling with depression, because while, of course, formal treatment is going to be important, the way that we're supporting our kids and the way that we're supporting the kids in our families and communities is also a huge piece of the puzzle for depression recovery. We won't be able to provide clinical recommendations about specific concerns arising with individual kids and teens. Just the scope of this talk is not sufficient, and I would be really talking out of pocket if I were giving you specific recommendations about a kid without knowing them and meeting them and doing my own kind of due diligence to make sure I'm giving you recommendations that are good for that specific kid. For individualized support, we really encourage you to reach out and contact us at the Center for Effective Therapy to learn more about what treatment options there are, whether that's through us or whether that's through other community providers. We would love to talk in more depth about specific concerns that are coming up. We just can't do that here. So we're going to talk about recognizing depression. What does it look like? How common is it? The treatment options that are out there, and then again, what we can do informally what we can do as people who care about the kids in our lives to support them. So what is depression? I think it's important for us to note most adults with depression actually recall their first depressive episode occurring in their teen years. So while we may think of depression as being something that occurs in adulthood or even older adulthood, most people who experience multiple episodes of depression during their lives have their first depressive episode when they are a teen. All of the symptoms of depression are common in both adult and child and adolescent depression, but there's population level differences between adults and children and adolescents. So the core symptoms of depression are feelings of sadness, hopelessness, irritability, loss of pleasure or interest in daily activities, occurring most of the day, every day, or most days of the week for at least a 2-week period. These symptoms on the left are our core things, and then the symptoms on the right are other symptoms that often go along with that. So we may see kids have changes in their appetite or their eating habits. That might look like eating more than usual, eating less than usual. For kids and teens, it may look like failing to make expected weight gains as opposed to a weight loss, because they're growing, they're getting taller. We would expect them to be gaining some pounds in that process as well. Oftentimes we see a loss of energy, fatigue, easily exhausted. A lot of kids experience insomnia. There may be physical complaints, so headaches, stomach aches, body aches that don't seem to have a physical cause, feelings of worthlessness or guilt. This can be free-floating guilt, or it could be they make a small mistake, but it seems like the end of the world. It seems like a really big problem. And some kids will have recurrent thoughts of death. That might be thoughts like, I wish I'd never been born, or it may be thoughts as severe as thoughts of suicide. And along with that, we'll also see difficulty concentrating or thinking, or like a feeling that thoughts are kind of slowed down. So thinking about those differences between what depression looks like in kids and teens and what depression looks like in adults, some of the symptoms that are more common in teens and kids as compared to adults are changes to appetite and weight gain and weight changes, loss of energy, insomnia, and those unexpected physical complaints. We put those into a category called vegetative symptoms, so symptoms that almost seem more physiological. They're more centered in the body than these cognitive changes like difficulty concentrating or loss of interest in things that are previously enjoyed, which we see more often with adults. All of these symptoms are common in both adults and teens and children, or all of adults and teens and children. They're just more common in some populations than others. Some other things that are not technically symptoms, but that often go along with depression, especially in kids and teenagers, are crying often, crying jags. Sometimes kids will say, I'm feeling sad out of nowhere, I'm crying and I don't even know what it's about. And we'll often see isolating from family and friends. That can go along with that symptom of not enjoying things they used to enjoy. Like it doesn't feel as fun to be with their friends as they used to, but sometimes it seems kind of separate. Some studies have found that irritability is more common in kids and adolescents with depression than in adults with depression, but some more recent analyses have not borne that out. So essentially the research is mixed. It may be that kids and teens experience more irritability, and it may be that it's consistent across the board. But irritability is shown to be present in about half of adults with depression and about 1/3 of kids and adolescents. There's no significant difference between kids and teens and adults in terms of the frequency of depressed mood, sleeping more than usual, slowed movements and thinking, worthlessness and guilt, insomnia, and thoughts of suicide. So these are things that are equally common in kids with depression and in adults with depression. Another important thing for us to keep in mind when we think about depression in kids and adolescents, as well as depression in adults, is this concept of comorbidity. So comorbidity is the presence of more than one health concern simultaneously in a given individual. So it's, this person is experiencing 2 diagnoses at the same time. comorbidities can be physical complaints and mental health complaints, can both be mental health concerns. So what we know about depression in kids and teens is that somewhere between 1/2 and 3/4 of adolescents who are diagnosed with depression have an anxiety disorder at the same time. The typical progression there is they probably started to have anxiety symptoms younger, and then it grew into these depression symptoms as they got older. This graph here reflects the prevalence of a co-occurring anxiety disorder for kids ages 3 to 17 who were diagnosed with depression in 2016 in a sample in the US. So about 74% of kids with a depression diagnosis had a co-occurring anxiety disorder at that time. And then almost half of kids and teens with depression have co-occurring behavioral problems. So that may be difficulty getting along with peers or adults, defiance, oppositionality, getting into a lot of arguments with adults, struggling to follow rules and expectations, whether at home or in other circumstances, in other locations where they may be. So we also see a lot of behavioral challenges co-occurring for kids with depression, which makes sense if we think about it. Kids who are struggling with behavioral issues are probably getting a lot of negative messages about their behavior that they may be internalizing as negative messages about themselves as people that could turn into some of these depression symptoms. One of the things I'm most excited about in terms of this educational series is bringing some awareness to things like the diagnosis gap and the treatment gap, especially for kids who are experiencing mental health needs. So this is a graph of kids ages 3 to 17 who are assessed in 2022 and had a previous formal diagnosis of depression. So someone in this child's life, whether a mental health provider, a primary care doctor, someone who specializes in assessment, has said this child is experiencing an episode of depression, or this child has a diagnosis of depression. Those diagnoses grow over time. So by the time a kid is 17, it is much more likely that they've had a diagnosis of depression in their life. About less than 1%, about 0.1% of kids ages 3 to 5 have ever received a diagnosis of depression from a doctor or other mental health provider. That's a really small number, but I think it's also important to consider that that means that there are 3, 4, and 5-year-olds who are experiencing significant symptoms of depression. That number rises to 2.3% of kids ages 6 to 11, and then 8.6% of adolescents ages 12 to 17. In adolescence, the past year prevalence rates of depression are similar to those in adults. So that means that if we think about adults who experience depression, we think about the total population of adults, about the same percentage of kids ages 12 to 17 have depression in the last year as adults who have depression in the last year. So we're seeing that in this age group, diagnosis rates approach that of what we consider to be typical for adulthood. So depression is not just an adulthood diagnosis. But that same report from 2022 looked at self-report data from adolescents and their caregivers asking about depression symptoms. So that previous slide was looking at kids who have had a formal diagnosis. This slide is looking at self-report data. So we can look at survey data from adolescents and from their caregivers and use survey data to inform, would this child most likely meet criteria for a depression diagnosis if they were assessed? On that self-report data, over 20% of kids 12 to 17 had met criteria for a depressive episode at some point in their life, even though less than 10% had received a diagnosis. So that's a diagnosis gap of at least 50%. So about 50% of kids who've experienced a depressive episode have not received a diagnosis, which means they most likely have not received any kind of treatment for those needs. 15% met criteria within the last year, so relatively recent. And then almost 6% met criteria in the last 2 weeks as of the time of that report data. So about 6% of kids were meeting criteria for depression at the moment that they were screened. In addition, over a third of high school students experienced persistent sadness or hopelessness in the last year. So that indicates that youth who don't meet criteria for a depression diagnosis may still be experiencing significant low mood that's probably impacting their functioning. The prevalence of depression in kids and adolescents has been growing over the last 2 decades. So we know that these numbers from 2000, from 2010, from 2022, we've seen an increase over time in the prevalence of depression in these age groups. Rates of treatment have also increased, but they haven't increased at the same pace as rates of depression. And then, extra concerningly, rates of mental health treatment access for kids with Medicaid or CHIP, so kids who are in the lowest income bracket and we may think of as potentially being the highest needs, actually decreased between 2005 and 2018. So despite increases in prevalence of these diagnoses, we've actually seen a decrease in treatment access for kids in that lowest income bracket. Oops. Sorry, skipped ahead several slides. Okay, back on track. So once we've identified that a kid is experiencing depression, what do we do about it? So when we think about what treatment works, what do we do for kids and adolescents that actually has been proven to have a positive impact on their symptoms, hopefully actually lift them completely out of depression, but at least give them some skills to function better and to feel better on a day-to-day basis. We think about evidence-based practices. So these are treatments that have been tested through clinical research and found to be effective. So we have a body of research evidence that says, yes, these treatments make an impact, these treatments make a difference for kids. The evidence-based practices that have been proven to be effective for kids and adolescents are cognitive behavioral therapy, interpersonal psychotherapy, which has only been tested and found evidence in adolescents. It hasn't been tested and found effective in children, and behavioral therapy. Behavioral therapy is it's a newer treatment. There is some research evidence that indicates it may be effective. So that is more on the cutting edge research. We don't have as much research to back that one up. But we know that CBT and interpersonal psychotherapy do have some strong evidence. So what does that mean? So at CET, we really specialize in cognitive behavioral therapy. It's also the treatment approach for depression that has the strongest body of evidence and has the longest lasting body of evidence. So that's where I'm going to focus today. So cognitive behavioral therapy is a psychotherapy approach that focuses on how a person's thoughts, feelings, and behaviors are linked to each other and connected with their daily functioning. So changes to any one of these areas, so changes to our thoughts, changes to our emotions, changes to our behavior, can impact those others and can result in an overall improvement in functioning. There are a number of treatment protocols that use a CBT approach. So what that means is CBT is both a formal treatment direction and a philosophy, a way of thinking about treatment and a way of thinking about what's going to be effective. So some of the treatment protocols that are kind of like the brand names that use CBT are the Modular Approach to Treatment for Children, or MATCH, Adolescent Coping with Depression, or CWD-A, which is a modification of a CBT for adults to apply to adolescents. There's a number of treatment protocols out there that use a CBT approach and have some kind of specific brand name to them. CBT has been proven to be effective when it's delivered both in an individual setting, so the young person is meeting one-on-one with a clinician and building skills on an individual basis, as well as in a group modality. So that is a number of kids or adolescents meeting with a clinician or maybe two clinicians, depending on the size of the group, and learning those skills together. Which works best for a given kid is going to depend on personality, is going to depend on where they're most comfortable learning those kinds of skills. Some kids do a great job learning from their peers, and that would be a really effective way for them to access treatment. For other kids, trying to learn something new in a group setting is going to be more stressful than it is beneficial. So it'll depend on your individual kid, what's going to be the best approach. CBT has also been found to be effective in preventing the onset of depression in at-risk adolescents. So this is when young people have been identified as having risk factors for depression, like particular stressors that they've experienced in their lives, or particular difficulties that they're going through, or they've got some early symptoms of depression, but they're not quite meeting criteria for a diagnosis. Access to CBT and participating in a CBT program can actually help to head off a depressive episode and really be beneficial in keeping those kids healthy. So when you, as a caregiver or a provider, are helping a family to find evidence-based treatment, helping a family and a child to find treatment that's going to be effective, we want to look for clinicians who have specific training in CBT. So that may look like classes that they've taken, that may look like formal supervision that they've received. And treatment should include psychoeducation, so learning about depression, learning about the symptoms of depression, some of the possible causes. It should include learning about specific strategies to identify and change negative thinking and behavior patterns. So if you think about a traditional talk therapy approach where you're going, kind of chatting about your day, chatting about your week, that can be beneficial, but it doesn't have the research evidence of something where we're actually looking at developing concrete strategies for examining our thought patterns, examining our behavior patterns, and making changes to try to improve how we're feeling. Treatment should also include take-home activities of some kind. Sometimes we call that homework, sometimes we call that home practice, but it should always include using those skills that they're learning in sessions out in the real world. Because it's one thing to come meet with a therapist and talk for 50 minutes to an hour and get some good skills, but if you're only practicing those skills during that 50-minute or an hour time slot and you're not using them in the rest of your life, they're going to have very little impact on how you're feeling on a day-to-day basis. So it's super, super important that kids and families are working with their clinician on what are you doing in between sessions to really use these strategies and find some improvement for yourself. And then the clinician should also be including parents or caregivers in treatment in some capacity so that they're learning the same information as the child and the adolescent and can support with skill use out in the real world. So kids developmentally aren't going to have the ability usually to learn something in one setting and then automatically be able to apply it in all of the real life circumstances where they're going to need to use those skills. They're going to need prompting from the adults in their lives to really use those skills to full effectiveness. When they have too much homework and they're feeling overwhelmed, or when they get in a fight with their best friend, or they get yelled at by the teacher, they're going to need adults to coach them on using those skills in the moment, because developmentally, they're just not going to be in a place where they're able to do that on their own yet. So let's talk about thinking about that treatment gap and how hard it is to access treatment sometimes for kids, and the child mental health crisis that we're really seeing. What can we do with our kids informally? What can we do to support them out in our communities, in our homes, to help them to cope with struggles that they might be having? So I want us to think about these three categories of connecting with our kids, facilitating their engagement with social activities and connecting with other people outside the home, and supporting healthy habits. And by healthy habits, I don't just mean physically healthy habits, but psychologically healthy habits. What are the things that help keep our brains and our bodies healthy? So in terms of connecting with our child, we want to think about trying to spend time individually with the kid for a few minutes each day. You'd be surprised how much difference a very small amount of time can have for a kid. And ideally 15 minutes. That would be amazing. But as little as 5 minutes a day can have a really big impact, especially if we're using that time to ask open-ended questions and really listen to their answers. And we want to offer support and understanding, not necessarily solutions or advice. So again, thinking about some of those depression symptoms, the difficulty thinking clearly, the perceived slow thinking, the irritability. Kids are not necessarily going to be in a space where when they're complaining about their day, they're ready to hear advice about what they should do differently. They may be able to get there. That may be something that they're open to at some point. But we want to stick to asking open-ended questions and drawing them out and just showing that we're listening and we're there for them and we're offering our support without necessarily trying to fix the problem for them right away. We also want to make sure we're showing interest in our child's social connections, and that means both online and in person, especially over the last 3-4 years of the pandemic with social distancing and school from home and work from home and all of these changes that have happened to our social lives and the way that we connect with other people. For a lot of kids, they find a lot of meaning in their online relationships. That doesn't mean that online relationships can be a replacement for in-person, live, face-to-face connections. But we also don't want to imply to a kid that their friendships online are not important to them. So we want to be asking about their social connections. Who are the people that they're spending time with? What do they like about the time they spend with those people? We also want to take time to express our appreciation and love for kids, especially when they're struggling in this way, and give them praise, specific praise for the things that they're doing well to combat negative self talk and feelings of worthlessness. So, again, feelings of worthlessness, talking negatively about ourselves, thinking negatively about ourselves, this is a huge part of depression symptomatology. And it's something that is really hard to shake from the inside. It's hard for kids to find a way to think differently about themselves. But if they're getting these positive messages about specific things that the people they care about appreciate about them, that is going to be really powerful in helping to combat some of those thoughts and feelings. When it comes to encouraging connection with other people and social engagement, it can be really powerful to set aside specific time to spend with kids in activities that they enjoy. So much of our time that we spend with kids is focused on tasks or teaching. So we're doing their homework with them. We're telling them to clean their room. We're taking them to their sports practices. But it's hard to find time to just be with our kids and do something enjoyable with them and do something that they're choosing without trying to use that time for teachable moments or for learning, just to be together. It's hugely beneficial for kids to just know, my parent, my caregiver, they just like being with me. It doesn't matter what we're doing. They like being around me. We can also help our kids plan time with friends or family while understanding that that may be really difficult for them to participate in when they're feeling low. The effort is so worth it because, again, that loss of interest in things that are important to us that comes along with depression, it can be really hard for them to push themselves to do things they would normally enjoy. But chances are, if they do push themselves and if we help them to schedule a time to hang out with a friend or go to their grandparents' house or go get ice cream with their neighbor, that's going to help them. It might not be as fun as it would be if they weren't depressed, but it's going to be better than not doing it. And then coming back to that conversation about screen time and about our online connections, we do want to make sure we're setting limits on screen time and encouraging live interaction, especially in person, over non-simultaneous interaction like texting or social media. Unfortunately, especially given kind of the direction the world has gone in terms of needing a lot of this non-simultaneous interaction and not having as many opportunities for face-to-face interaction as there used to be, research has found that communicating primarily over texting or social media tends to increase feelings of isolation. So kids may express, I feel better when I'm texting, or I feel better when I'm scrolling on, I'm not cool. I don't know what the cool social media is, but whatever the cool social media is that kids are doing, they may say that they feel better while they're doing that. but it's usually not accurate. They don't have a lot of insight into how these things are impacting them in the moment. And that is a, oops, goodness, sorry. One more bullet point before I switch. That is a really hard conversation to have with kids sometimes because of that lack of insight and because it's hard for them to pull themselves away from something that does feel like it's giving them some kind of burst of energy or feeling of connection, even if something different would have a much better impact for them. And then thinking about these healthy habits that support physical and mental well-being. This is a tough sell for a lot of kids, but pediatricians, the American Academy of Pediatrics really recommends physical activity for at least an hour a day for kids and adolescents. And that can be in any way that feels good for them. It doesn't have to be going for a run, it doesn't have to be joining a sports team, but it might be. It might be sports, it might be going to the gym, it might be taking a walk, playing catch in the yard, dancing, taking the dog for a walk, training the dog. Anything that gets their body up and moving is going to be really beneficial, and every moment adds up. So it might not be an hour straight, it might be a few minutes in the morning, a few minutes on their lunch break at school, a few minutes when they get home from school. But building in pockets of physical activity is really important in helping our bodies to cope with stressors and to cope with depression and to help our bodies help us back. And actually, like my fun fact that I plug with a lot of kids is physical exercise in the absence of any other change has been found to improve depression symptoms. So if you do nothing else to help yourself when you're feeling down, doing some kind of physical exercise has benefit, even if you don't do anything else. When it comes to trying to encourage kids to do physical exercise, encouraging them to participate in activities that they've enjoyed in the past and do it to the best of their current ability. If they're feeling really depressed, if they're having this fatigue and exhaustion, they're probably not going to be at the level they might be if they were a competitive gymnast before. But doing some physical activity that has given them that boost of enjoyment in the past is going to be really helpful for them. We want to encourage kids to eat healthy meals with a variety of fruits and vegetables, whole grains, and protein. I am not a nutrition specialist. I'm not going to give you any more guidance than that, but work with your kids' PCP or other medical providers that you trust to figure out what's going to be a healthy diet for kids who may be struggling with appetite changes as a result of their mood difficulties. And then we also really want to encourage kids to be getting enough sleep. School age kids, so up to that like 12 or 13 age, need about 9 to 12 hours of sleep a night. That's a tall order, especially when kids are in sports and they're in school and they've got homework and they have all these demands on their time. But trying to really prioritize getting that 9 to 12 hours of sleep. And teens need an average of 8 to 10, most of them on the upper end of that range. And we want to limit screen time that's used for entertainment. So this is things like video games, again, social media, TV, that kind of thing. Try for 2 hours or less a day. And then we want to maintain consistent routines at home. That can be really beneficial for kids, is knowing what to expect. Predictability is really supportive for a lot of kids. And then depression does come sometimes for some young people with these thoughts of death or thoughts of suicide. It is not a one-to-one. Not every kid who experiences depression or experiences depressive symptoms is going to have thoughts of suicide or is going to be at risk of harming themselves, but some kids will be. And that's a really hard conversation for us as folks who care about kids, whether we're parents or not. But if you're worried about your child's safety because of their depression symptoms, if they are in immediate risk because of what's going on for them, we want to make sure you're seeking help right away. So in Massachusetts, we're really lucky to have a couple of wonderful resources. The Behavioral Health Helpline is a 24/7, fully free, toll-free number that anyone in the state can call to access emergency mental health supports. They can do kind of triaging and help with figuring out what's going to be the best way for you to access services for your kid that's going to be helpful to them in this moment right now. We also have community behavioral health centers in the state of Mass. So every community has our local community behavioral health centers. They usually have, or all of them have, some sort of walk-in hours where you can access services very quickly. There's still going to be a wait time. We are still in a mental health crisis, but it's a way to get services relatively quickly. And then in a true emergency, you can always go to your local emergency department. So the closest emergency department to you, and then they can help you figure out what's going to be the way to get some services. And you can also help to make your home and the locations where your child spends time safer for them during a crisis by removing or securing things that are particularly harmful to them in a moment of crisis. So this is things like weapons. Firearms should be secured in a safe location where kids don't have access to them. Alcohol, medication, both prescription and over-the-counter medications, and harmful chemicals like cleaning products should be secured when a kid is actively in a mental health crisis. And then just kind of a plug for make sure you're getting your information from reputable sources. These are some of my sources. I'm not just making it up. But let's go to questions.
Sarah, none came to me, so I just encourage people to really nice talk. Thank you so much for all the resources and information that you shared with us in a very short period of time. If you have any questions for Sarah, please feel free to unmute and ask your question. If you're a little camera shy, please feel free to send it to me and I will read it for you. So we have a question about what depression scale you might use to help assess depression in teens.
Ooh, that's a good question. I know the one that's coming to mind is the PHQ-9. We don't actually use that at CET, but it's a scale that has a lot of validity behind it. That's the Patient Health Questionnaire. It's a very brief form. Remind me what we use. I'm blanking. I love this.
We use the Child Depression Inventory or the CDI, which are some of the Beck depression scales. The PHQ-9 is a great one because I think it's free and publicly sourced as well. Sarah, I have a question, and honestly, even some standard things like just pulling a couple questions, like some of the symptoms that Sarah described in the beginning. Do you feel sad a lot? Do you, feel less pleasure than things that you used to enjoy? Getting a couple little items and having a kid rate from 0 to 10 how impairing they are can just help you sort of get a baseline assessment of symptoms and also monitor. But screeners are a great way because a lot of these internalizing problems fly under the radar and we don't always know what's going on, especially with teens who love to keep things sort of close to the chest.
Definitely. Some of these things can show up in terms of, changes to their academic performance, difficulties with attending school or skipping class more often, kind of feeling less motivated by things that they're usually very, very interested in and very motivated by is a common way that these things can show up for kids. It may not look like sadness on the outside.
Sarah, I have another question asking if parents have depression, are children more prone to depression?
Ooh, I love this question because the research says yes, and we have some hypotheses as to why. So some of that is, do adults who have really strong skills in managing their own emotions and taking care of themselves model those skills to their children so their children have more resiliency in that way? Is there a genetic component? We believe there probably is a genetic component to depression and anxiety. Are there stressors that are happening for the family as a whole that are impacting both adults and kids in the family? And actually, one of the research studies I mentioned, the one that looked at providing CBT for at-risk teens as a way of preventing onset of depression symptoms. That was one of the criteria for adolescents who participated in that study, was if they had a parent who was currently depressed or had a history of major depression episodes. So yes, and treatments can still be really supportive for those kids and for those families. And sometimes that's one of the benefits of CBT and the parent component of CBT is parents are also participating in those sessions, and they may use those skills for themselves and find them to be really helpful. And that can be powerful, powerful modeling for kids, that we're not just saying, oh, you should do this, you should do that when you're feeling upset or when something's bothering you, but I'm going to use it too, and I find it helpful.
So Sarah, we have a question. This is a great one. We talk a little bit about irritable depression or some of the oppositionality that can occur, especially with teens. So how do we get our teens to do the things like getting involved in sports, eating well, limiting screen time, all the sort of hygiene factors that you talked about, if they're displaying oppositional depression or anxiety?
Yes. Oh, that's such a good question. And isn't that the conundrum of like teenagers as a whole, not just depressed teenagers? So such a good question. So different strategies are going to work for different kids. Some kids are really motivated by some kind of reward system of like, hey, I know this is really hard for you. I know that it's hard for you to do the things that I know are going to be helpful to you because of the way your mental health is impacting your ability to follow through on some of these strategies that would be helpful to you. What would be a meaningful thing for you to earn when you are pushing yourself to do these hard things? What's something that we could do as a family that would help you to feel like we appreciate the effort that you're putting in, and helping kids to come up with things that they're working toward? And then worst comes to worst, I'm not opposed to things like putting screen time limits on the device itself so that it's shutting itself off automatically.
Some things we also do at our center are just trying to get kids to do a little what we call a mood booster in the moment. So if they're like, none of that's going to work, I'm not going to engage in sort of thinking with you about strategies that might be useful. Doing something silly like putting on some music, getting them up and dancing. Trash can basketball is like one of our favorite ones. None of these are going to be like a favorite activity for a kid, but just getting up, getting silly, getting them moving, and then helping them see like, oh, even if that wasn't like the most fun thing, I do feel a little bit better than kind of sitting in my like low depressed state, is a little way to get a little buy-in and say like, if we found something that was actually fun for you or that you actually really like to do, maybe you'd feel even more better. So just kind of finding moments where we can kind of like get them to pull the hoodie off their head, get out of the slump, and start sort of doing something a little different.
One of the big ways that depression plays tricks on us and prevents us from doing things that help ourselves is through a perception that anything that might possibly help me is going to be way too hard for me to do and isn't going to help me anyway. So doing some bargaining of, what if you did it for 5 minutes? And then if you hate it after 5 minutes, you can quit, and I won't ask you to do it again today. Getting some level of buy-in of like, give it 1 minute, give it 5 minutes, give it 3 tries, can be helpful, because usually it ends up not being as hard as we thought it was going to be, and it's more helpful than we thought it was going to be. Even if it isn't perfect, even if we don't feel amazing after doing it, we feel a little bit better, and that can help give some momentum to keep moving forward.
Sorry, we got more questions for you. So this person is asking, sort of with a lack of in-person therapy services available, how do we get a child to engage in therapy?
I'm imagining this question is about like, well, I can access telehealth therapy for my child. I can find a therapist that they can meet with over the screen in some way. And I think it depends on what's getting in the way of engaging over telehealth. So some things that I as a clinician do to try to get kids engaged is that mood booster. So obviously it's not going to be trash can basketball because we're not in person, but I might have them put on their favorite music and do that at the beginning of session as a way to get them engaged. I might uh, encourage them to, I might find some ways to make telehealth therapy more interactive through creating a Jeopardy game where we're going to test your knowledge instead of I'm just lecturing at you, because that's not how kids learn anyway. So finding ways to make telehealth therapy more interactive can be really powerful. Some other things that I've found to be helpful is having kids like show me around your room. You don't have to, if you've got a computer that can be moved around, like show me around your room, bring your favorite toy up to the screen and tell me about the favorite thing that you have in your room. Finding ways to build that connection even through a screen.
And I would just add to all of Sarah's really helpful suggestions that sometimes, especially teens who are struggling with depression, are really the people who are primary candidates for in-person therapy. So if you're like, we've tried these strategies, we're doing CBT, and it's just not landing on telehealth, I'd really try to think about like, who are some of the centers that are doing in-person therapy. We have in-person availability in both our Boston and Waltham locations. So if that's a need, if they've tried it out, sometimes it's just getting started in that relationship in person, and then you could transition back to telehealth if that's sort of more convenient for your family. I know there's a lot of barriers that are lifted through telehealth, but especially teens, it can just be hard with depression. It can be really hard to start that therapeutic relationship via telehealth. So, some things to think about there. Sarah, someone asked, can a child get over depression?
Ooh, yes. So some kids, there exists spontaneous recovery where like there is there's a particular stressor and it's really impacting the kid and they're really struggling, and then that stressor is alleviated and they start to feel better spontaneously because things have changed. But the evidence is really behind getting them some sort of evidence-based treatment, because especially for a child or a teen who has an episode of depression, that does increase the likelihood that they'll have future episodes of depression in their life. So it's really important to make sure that we are trying to get kids into formal treatment and getting them these skills, because those skills will benefit them throughout their life. If they have further episodes of depression, if they have another stressful thing in their life, when they go off to college, when they move to their first city where they don't know anyone, when they have further stressful events in their lives, having those skills are going to be really effective and really supportive in managing future challenges as well.
So Sarah, what I hear you saying is if someone's struggling with depression, they're sort of at a higher likelihood to struggle with depression again. And so treatment might get rid of the current depressive episode, but also empower someone with the tools to say, if and when these stressors come up again, which they likely will, because that's sort of part of life, I'm better able to notice them, sort of catch them early, and then use some of the strategies I've learned in CBT to effectively manage them.
Exactly. Yeah.
We have time for a couple more questions if anyone has any. So this is someone asking about TMS, which stands for transmagnetic stimulation in kids. Thinking about sort of, we're really talking about psychotherapy, but questions around things like TMS or medication.
I do know that there is some really good evidence for medication, whether it's medication on its own or medication as a concurrent treatment with psychotherapy. I would definitely talk with your child's primary care doctor or a psychiatrist specializing in child and adolescent depression to talk about which medications are the most effective for kids, because there are differences in medication effectiveness between kids, adolescents, and adults. And some medications have been tested in certain populations and not others. So I would say medication, I would definitely defer to a medical doctor. Just don't want to talk outside my wheelhouse and give you information that wouldn't be accurate. And I do know that TMS is kind of up and coming in terms of the research. I am not personally up on the research of the effectiveness, but I know it's had some good effectiveness in certain populations of treatment-resistant depression, especially in adults. I just don't know what the current state of the research is for kids and teens.
And I think just to sort of chime in, my understanding, Sarah used a term that said treatment resistant depression. So I believe that part of why we don't know a ton about the research on TMS is because it's really new. And when we're talking about treatment resistant depression, what we're saying is we've really exhausted the most sort of empirically supported, the treatments that are proven to work. So they've done CBT, they've maybe tried a medication trial, they've done both together, and really with a good faith effort that hasn't been effective, that's when someone would consider sort of a newer wave intervention like TMS. But I think the research is still out on how effective it is for kids, because it's just harder to test things like that with a more vulnerable population like children and teens. Any other questions that we can answer before we wrap for today? You know, depression, suicide prevention, these are really big topics, and there's a whole lot out there with COVID and the impact on our teens and the impact of social media. So there's probably tons more that we could talk about, but you know, thank you, Sarah, for giving us a really great overview in the time that we have. Just a plug for anyone on our call today that we're really hoping for input from all of you on different topics that you'd like us to cover in the future. So we sort of did a first pass at things that we thought would be helpful, but please, please, please let us know new topics that you'd like us to talk about. I also put the link on for our resource page in the chat. So you'll find that there are blog posts to complement these talks. There's also social media posts on our Instagram, and our information is there. So we really hope that you follow us, that you give us some feedback, and that you share accordingly. And most importantly, if you're a caregiver of a kid who's struggling, or a counselor or clinician, thank you for what you're doing to support that kiddo already. And please don't worry alone. You know, please reach out to us if there is any help that we can provide. And we're happy to, you know, sort of hold your hand and give some support through what can be a really difficult topic and time. And yes, we will make the recordings available on our website and also on our YouTube channel. So thank you all so much. And we look forward to hearing more feedback from you. And the link for feedback is now in the chat that Caroline posted. Right, we will stay on if there's any more lingering questions for a couple moments, and hope you all have a great rest of your day. Thank you.
Right. Thank you, everyone.